stay safe while we honor those who paid the ultimate price to protect our freedoms on Memorial Day, as we always do. And, it was a particularly difficult Memorial Day as a moment of reflection because a large portion of our veteran population here in Colorado falls into a high-risk category for COVID-19. In fact, we learned that we lost another veteran last night at the Veteran Community Living Center Fitzsimmons, bringing their death toll from coronavirus to 15. And while we know we can't get the virus entirely out of Colorado, our team is doing everything we can to reduce further spread, protect our heroes, protect our veterans. And I want to thank the staff that's working tirelessly at Fitzsimmons to save lives through resident education, through mask wearing, through testing, through physical distancing. They're really following all the safety guidelines from the CDC and CDPHE. And it's truly heartbreaking, I know, for the staff and fellow residents to experience these losses. But I want to thank them for doing everything they can to give the best care possible under these circumstances to protect our veterans. America's losses are great. We've lost more in the last few months to coronavirus than we did during the entire Vietnam and Korean War. And the losses aren't over. The losses aren't over nationally. And while they're trending in the right direction in Colorado, they certainly aren't over in Colorado. And as we enter this phase of increasing individual responsibility, it really falls on all of us to be smart, to wear masks in public, to stay home when we can, when we're out in nature, to avoid being near others, and to keep our group sizes to 10 and less. And as we reflect on Memorial Day, I want to take a brief moment of silence for all the service members who've lost their lives throughout history, both in action, as we acknowledge Memorial Day, including the 15 at Fitzsimmons that we've lost to this cruel virus. And we'll just take a brief moment of silence for our veterans that we've lost. Thank you. I have a number of decisions that we are making about how we can make sure that people have more opportunities to live in a sustainable way, in as safe a way as possible. First, I want to give a quick update on where we are as a state. 24,500 cases, just under 400 currently hospitalized. Isn't that wonderful? It's the first time we've been under 400 since the start of that crisis. It could certainly tip back up above 400, but certainly welcome news. And we have over 1,000 deaths, 1,088 due to COVID, 1,340 who died with COVID, and for many it was a contributing factor. The trends look good in terms of new cases. 11 of the last 14 days have a downward trend on the moving average. And for hospitalizations, 12 of the last 14 days have a downward trend. You know, it was a month ago, April 26th, where we ended the stay-at-home order for Colorado. And we knew going into that was a bet on the people of Colorado, a bet on the people to make the right decisions. It was a risk. There were those in my administration and the health community that thought we should continue the stay-at-home order longer. I argued, and I hope that the data continues to bear it out, that we need to trust the people of Colorado to make the right decisions. And so far the evidence bears that out. We're looking for a more complete model on the impact of the end of stay-at-home and transition to safer at home in just a few days on May 29th. Some of you attended there was a webinar on the preliminary data today, but so far it looks good. And as you know, this is what we're looking at. When we say it looks good, by the way, still dangerous, virus still here, about 400 people hospitalized, 200-300 that we know of contracting it every day in our state, and probably twice that, if not more. So it's relative. There's losses ahead. There's losses behind us. The risk is lower than it was a month ago, but the risk is still higher than it normally is during normal times. So it was a month ago that we ended the stay-at-home order, and we said we would look at certain things. We'd look at what was the level of suppression of the virus that we would achieve. How is our ability to do testing and containment? How well are we protecting vulnerable populations? Does our healthcare system have the capacity for a surge? What's the level of risk and benefit, economic, psychological, societal, of these different measures? And is the policy sustainable? So I want to walk you through. We've now had a month. We were one of the earliest states to end the stay-at-home order. We are now looking at how Coloradans have done, behaving responsibly individually, being smart. And so far, while not conclusive, it's never conclusive. We were always wish we had next week's data today, next month's data this month. But so far, the indications are good. In the beginning, we were seeing an exponential rise in cases. Each person was spreading the virus to between 3 and 4 other people, that R-naught value that we talked about. This was an exponential growth curve. We acted quickly. We acted boldly. The R-naught value has been hovering around 1, we believe now, which even slightly below 1. So the out-of-control exponential growth of the virus stopped, and we need to keep that up. We need to keep that up. Again, Coloradans contract this virus every day. We lose and we lose people every day, but that exponential growth has been leveled out, and that's the challenge on us to continue acting responsibly and smartly to keep that from expanding rapidly again. And this progress wouldn't have happened if it wasn't for your efforts to take safer at home seriously. People are still smartly staying at home most of the time. People are significantly reducing their in-person interactions. People are wearing masks in public. Not everybody, but many people, and I encourage everybody to do so. Older Coloradans and those with underlying health conditions are taking extra precautions and only going out and interacting when it's absolutely necessary. And yes, we've scaled up our testing capabilities rapidly. In fact, I'm proud to announce that we're currently testing 4,000 to 5,000 Coloradans a day. On Friday of last week, we tested over 6,000 in a single day, including more than 2,000 at the state lab. And we now have the capacity to meet the 8,500 per day goal, which we said we would have by the end of May, and we have that. Testing is free, it's quick, it's easy. You can find a testing site near you at covid19.colorado.gov. If you're symptomatic, it's free, it's easy, it's quick. Get tested. It's very important that we know about you and who you've been in contact with to control the spread of this virus. But you know, we're not coming to you to stick a swab up your nose. You have to do the last part. You have to come in. If you're feeling ill, if you're a healthcare worker or senior facility worker who's asymptomatic, please come in, get tested. It's free, it's quick and easy. covid19.colorado.gov, the Pepsi Center, over 35 sites across the state. Really important to make sure that we can identify cases early and act accordingly. And you want to know whether what you have is a cold or flu or whether it's COVID-19, in which case we need to make sure that your friends and families or others are warned and you take additional steps to isolate yourself to prevent the spread of this deadly virus. Another criteria is our increasing ability to protect the elderly and those who are vulnerable in skilled nursing facilities and other congregate living facilities. 90% of the Coloradans that we've lost to coronavirus are over the age of 60. That's stunning. That's sad. Each one a terrible loss. And we're taking a lot of steps around where seniors live together. If you're a senior that lives by yourself in your home or with your spouse, you're taking your own steps like my parents are. My mom just turned 76. My dad turned 76 last month. And they are staying at home, even to the point of having groceries delivered. And we love them too much to bring the grandkids over and see them for the month of June. But for those who live in nursing homes and congregate living facilities, we've limited visitation. We've set up special rules for the senior facility staff members. We are with the Colorado National Guard and in partnership with Colorado State University directing testing to test workers that are asymptomatic, just regular workers, screening out people that are contagious but not yet ill themselves. And we're launching an 8-week testing period in partnership with CSU at 30 of our largest senior homes. So it remains our top priority, and we're stepping it up. Another benchmark has been preserving the ability of our healthcare system to handle a potential surge. Very good news, under 400 hospitalized for the first time. Again, that could go above and below 400. But as a moment of reflection, hospitals have done a great job expanding their capacity. We built filled hospitals to expand to meet our surge capacity. We hope we never need them, but we feel better that they're there. And on the masks and gloves and gowns, we've made great progress. In fact, today I'm announcing that thanks to the hard work of our innovation response team, we've secured a 17-month contract with Honeywell for 6 million medical-grade N95 masks to be delivered to Colorado to keep our frontline healthcare workers safe. I also joined the Vice President on a call this morning where I talked about continuing our partnership with the federal government to supply high-quality PPE to our nursing homes. They received their first shipment. They'll be receiving an additional shipment shortly. Very important partnership with the federal government. So given where we are with this criteria, we're beginning how we can behave more normal and how we can return to normalcy. And we began, as you know, with retail and personal services and real estate, offices at 50%, our state parks. Many counties in Colorado, I think we're up to 12 or 13 or more, have additional variances in place because they have low viral count and they're able to have gyms open and other kinds of activities. And if counties weren't comfortable going that far, then we wouldn't be able to do it. And we have low virus counts in some areas of the state, and all these decisions are made on the level of risk versus benefit of different activities and how we can support our economy, our society, and our psychological well-being. We all know that being shut in and at home is very difficult economically and very difficult psychologically. Because humans are social animals and we rely on our normalcy and our social interactions. And some things we know that we're not ready for yet in the foreseeable future. I would love to go to a Rockies game or a concert at Red Rocks, but 10,000 people packed into a crowded stadium or amphitheater would set the whole state back. It's inevitable with the level of infection we have. Roughly 1 in 3 to 500 people are contagious. There would be a number of contagious people that would lead to dozens and dozens of additional infections at a very large get-together like that. But other activities can be made safer, and we're issuing guidelines using science to make them as safe as possible. Now, as safe as possible doesn't mean that that depending on what you think as an individual, it may not be safe enough for you, and that's fine. It may be something you're going to do anyway, and you're glad that we at least have some safety precautions around that to reduce, not eliminate, reduce your potential exposure to COVID. Using these criteria yesterday, we made a number of major announcements at the state level. There are local orders in some areas that are more restrictive than statewide orders. Other counties with low virus count have variances that are open even more. But these are the base statewide guidelines. There are some areas that because of high viral count might have more restrictions in place, because of low viral count might be able to go a little bit further. First, we let the prohibition on skiing expire. That was wonderful news. No Coloradan ever wants to, and no Colorado governor can even fathom a prohibition on skiing. I certainly couldn't. Very difficult action to take. But thankfully we took it, and that helped prevent the exponential curve. And now Arapahoe Basin in Summit County is opening tomorrow with strict precautions for the lift lines, a mask requirement. It's skiing for the athletic fun of skiing. It means that, yes, skiing with your group, skiing alone, skiing with who you go with. It's not the social adventure of skiing, meaning there's no après-ski, there's no bars and dining, there's no hanging out on the slopes. If anybody's been to a basin in a normal, June skiing day or May skiing day, it's a party-like environment at the base and even on the mountains. That's not what this is. This is skiing for skiing, and the skiing piece itself relatively safe, easy to do, social distancing, enjoy the slopes. But you go there, you come back, and there's very limited capacity that they're open up for anyway. I think they've sold out for the days that they've sold for. They're selling tickets only a few days ahead, pass holders. So check out that Arapahoe Basin information. I think they'll likely keep it open as long as the snow permits. It's the athletic and individual experience of skiing, but it's not the normal party post-skiing environment. So if you're in it for the actual skiing, this could be for you. If you're in it for the partying and keggers and hanging out and dancing, now's not the time. They're not open for that kind of activity. It's simply for the athletic act of skiing, which is a very reasonably safe way to be able to recreate in our beautiful outdoors. In addition, private campsites are now open. As you know, we open state parks campsites on May 12th. People can camp. It's a wonderful way to get away with your family, spend some time at the beautiful outdoors. And as you've heard me say before, it's low risk to be outdoors with yourself or with others that are in your family unit. But we're asking that you undertake the activities in a way where you're just focused on being outdoors, right? You go somewhere, you go camping, you go to a private or state campsite, have fun, you go skiing, you come back. It's not about hanging out in local restaurants, grocery stores, gas stations, mixing with others. You might unwittingly be infecting them. They might unwittingly be infecting you. Enjoy our great outdoors in a spaced out fashion. Colorado is a big state. And whether that's skiing or camping, those activities are relatively safe compared to others. But the activities along the way that people traditionally associate with those are less safe. And so do the outdoor stuff for the sake of doing the outdoor stuff. It's fun. It's beautiful. It's May. It's almost June. But not that other social stuff that comes along with it, right? We're going to enjoy the outdoors for the sake of the outdoors, do it safely, and do it apart from others with our family group. And we'll have some fun. We'll enjoy our great state, and we'll do it in a reasonably safe way. I also made the decision to allow restaurants to reopen sooner rather than later for dine-in service. They're opening at 50% capacity. And I want to acknowledge the pain that our restaurants have been through. And that means everybody. It means, of course, restaurant owners, but it also means the chefs, sous chefs, bussers, wait staff, greeters, and door people, everybody associated with restaurants, as well as people in the food supply chain that have suffered loss of jobs because of the closure of restaurants. And the level of economic activity around restaurants is very important for all of us. Restaurants employ about 300,000 Coloradans. That's about 10% of the entire state workforce. So about 1 in 10 people work in or around restaurants. And restaurants also fill an important societal and psychological benefit. It's not just about the economics. Humans are social beings. We need those personal interactions to stay mentally healthy. And sharing a meal, breaking the bread, is one of the most important ways we bond with one another, the most important traditions and social activities that we have in human society. And we want to do that in as safe a way as possible. Of course, it's safer to have dinner in your home, but for those who are ready to go out, who want to go out, we want to make sure it's done in as safe a way as possible. Also keeping the workers that work in food preparation and in our restaurants as safe as possible as well. So how do we do that? First, we limit the number of people that can be inside at a single time up to half the normal capacity. So those tables can be spaced out at least 6 feet from one another. Restaurants, you go with the party that you came with. It's up to 8, right? Could be 4 or 2 or 6. The party you come with, you sit down, you enjoy the meal yourselves. You're not the social ambiance around restaurants is you're not talking to people at other tables in normal times. So that continues, but you enjoy the people that you're going there with. They could be part of your household. You might be mixing with one other household, and parties of 8 or less. And all the employees, all the wait staff are going to be wearing face coverings. That's for their protection and for yours. This is not a food-borne virus, right? It's different than traditional challenges, health challenges that restaurants successfully face, right? In normal times, restaurants deal with hepatitis, with salmonella. Salmonella is a food-based contagion, food-based outbreak. I actually think I read somewhere that there was a salmonella incident somewhere. This is a human-borne virus, right? So it's not a food-borne virus. That's why throughout all of this, delivery of food, takeout food, fine. It is a human-borne virus. So the employees will be wearing face masks. Of course, surfaces will be cleaned and disinfected. Instead of tablecloths, there'll be temporary coverings. as much ventilation as possible. And then we're suspending all the different state rules that maximize outdoor dining services. And of course, encouraging our local government friends to make public spaces available for outside dining. So restaurants can expand on their own property outdoors. They can expand on adjacent or non-adjacent private plots nearby, as long as they have permission of the landowner. And then subject to permission from their local government, they might be opening sidewalks or parking lots or other public areas for dining as well. This is beneficial for a number of reasons. One, the airflow is simply better outdoors. So for whatever level of spacing you have, better to be outdoors than indoors. Secondly, it allows for more spacing and allows for the restaurants to be able to survive, because at 50%, many of them can't get by. This is a way where they can be at 100% of the normal capacity or even more, whatever their kitchen can handle if the customers are there, because people are spread apart outdoors. 9 out of 10 summer nights are beautiful for dining, incredible for dining outside. Not every day is. Occasionally it rains. Occasionally people think it's too hot, but 9 out of 10 days are wonderful for outdoor dining, and it's a safer way to enjoy a meal and break bread with friends than indoor dining. We also are moving forward with the way that summer camps can operate with strict precautions. Keep in mind that we've had daycare open now for some time. For essential workers, it was open the entire time period, but public daycare that's available for families who work has been basically open since the stay-at-home order ended, and that's been in groups of 10 or less. Summer camps are similar. It's 10 or less indoors, but we are allowing a bit more discretion outdoors, and many summer camps are traditionally outdoors, groups of 25 or less, without mixing cohorts, meaning it's a group of 25, they're with the counselor, they're spread out to the extent they can be outside, and with the precautions around temperature checks and symptom screening, and making sure that that's done in as safe a way as possible. So summer camp's important. It's important for kids who, at this point, if yours are like mine, are desperate to get out of the house and see friends and make memories. It's also important for parents. It plays a similar role to daycare, which has already been open, that allows parents to go back to work while their kids are at camp, for those parents who can't work from home, or just have a little peace and quiet in the house. So it's not too different than what we've been doing already with daycare. In the summer camp environment, it's allowing for additional discretion in the great outdoors and larger class sizes or cohort sizes, as long as that mixing isn't occurring. And we have a number of additional ways that we're reducing that risk, and those are all being implemented. All of this information is at covid19.colorado.gov. So here's a recap of the timeline, because Coloradans want to know this. May 25th, private campsites open. The spring skiing was allowed. Local communities decided that doesn't mean it started on the 25th, but the state prohibition was eliminated. Many of them are working to do that, at least at Arapahoe Basin. I think Copper might open for training. It depends where they have good snow. May 27th, that's tomorrow, in-person dining can resume. And that's for those who want to go out. Every activity has a heightened risk over the profile of that activity last January. So it's up to individuals to make smart choices. If you're going to do these things, be smart, wear a mask, keep the group small. Let's be safe and prevent additional outbreak. And then June 1st, that's a Monday, that's next Monday, children's summer camps can open. Now, many of them had canceled already due to parents pulling out, and some might not be available, the one you wanted for your kid in early June. But check with the camps. They're preparing. Some of them are opening later. Some aren't opening at all. Some are opening June 1st. But they can open June 1st if they want to. We will also be talking about what June looks like on June 1st. And we try to do this because people need to plan. We have lives. People need to plan, know what the month looks like. So June 1st, just like we've done around the start of every month, we've said this is kind of what June looks like. There might be a few decisions we make mid-June, but here's what it looks like. And of course, for these decisions where people needed that lead time, like restaurants and day camps, they are already getting up and going. But the most important factor here is really up to you, the people of Colorado. It's how well we succeed at social distancing and wearing masks in public. It really is that simple. Avoiding groups of 10 or more, staying 6 feet apart from others where we can, wearing masks in public. And so far, you've done an amazing job. That's just not me saying that. That's borne out in the numbers. If you didn't do an amazing job, there's no cheating here. Our infection rate would be increasing like it is in some states. It has been decreasing and leveled off in Colorado thanks to you. And things aren't going back to normal yet. There's baby steps, right? And be smart. We need to keep following these common sense rules. You know what it is you need to do, right? We know we need to wear masks when we're in public, when you're going into a store, if you're going to a restaurant, you take it off when you sit down and eat, but when you're, out of respect to the people that work there and yourself, when you go in the restaurant, start by wearing it. And of course, whenever you're in public with others. And when you're outside having fun at a park or anywhere else, important to be at least 6 feet apart from other parties that aren't in your household. If we can do these things, we can continue to level off or drive down this infection rate. I mean, it really is up to us, up to you to be able to do this. And again, the particular efforts for those who are older and might be at risk. My parents are not going to parks. They're certainly not going to restaurants. They're not leaving their house. They're 76. They're relatively healthy. My mom has some respiratory conditions. My dad is perfectly healthy. But at that age, even without pre-existing conditions, this virus is a major risk for them. And with the fact that I go out and interact with people sometimes, that others in our family do, we don't want to put them at risk, and they don't want to be at risk, even as much as they'd love to see the grandkids now. They want to wait till July or August, because you know what? We want them to be there for our kids' graduations, our kids' marriages. We want them to be great grandparents someday. And it would be foolish to put that all at risk by trying to see them and have fun too soon. We know that we want to be smart about this, and I know that Coloradans are being smart about this. Before questions, I also want to talk briefly about the upcoming state legislative session. It's starting. You all might have heard our legislature is back, Republicans and Democrats swarming the state capitol, beginning their meetings. And I want to start by thanking the Joint Budget Committee. They actually started weeks ago. They have been tasked with a very solemn task, and that's balancing our state budget, including the devastating cuts that need to be made. In Colorado, we have a balanced budget requirement. I agree that we should. It's required under law. The federal government doesn't, but Colorado does. We should. And they came back. They did the hard work. They balanced it. Every cut they made, not just numbers in a spreadsheet, it impacts people's lives. Because when schools lose funding, of course, education suffers. When we don't invest in public health, our ability to respond and save lives suffers. When we don't address health care, there's people that they can't afford it, don't get it, or go bankrupt. So we're in a unique moment because we need to save as many lives as possible, limit the spread of COVID, not only because it's the right thing to do, but because of the impact on our economy. And our budget will be even worse if we don't succeed. If you don't succeed in suppressing this deadly virus by making the right choices, the responsible choices in our individual lives. And the focus of this legislative session is on building a resilient response from a healthcare perspective and from an economic perspective. For Colorado, in the face of this pandemic, which is still very much with us and will be with us for months to come, we want to work with Republicans and Democrats in the legislature to make sure that we have a real resilient response economically and from a health perspective. Now more than ever, we need to make sure that people have access to affordable health care. For years, we've been talking about how Americans are sick and tired of getting ripped off on health care costs. And the high cost of COVID crisis could potentially make that worse. That's why it's important that, of course, the testing is free, quick, easy, no out-of-pocket. Pepsi Center, 35 other sites across the state, covid19.colorado.gov. But it's also about insurance, right? It's about protecting savings from the reinsurance program and enhancing coverage options and opportunities for others that are struggling to get insurance, particularly those who might have lost their employer-based insurance. It's about putting some of our changes that we've temporarily done in telehealth through executive order into state law so people can continue to have access to reduced cost, convenient telehealth services during and after this pandemic. And it's about pharmaceutical transparency to lower the cost of prescription drugs, which has been a top priority before COVID struck and remains a top priority during COVID. We also need to support the businesses and workers that are struggling as a result of this crisis. And there's so many that have lost income, lost revenue. Many families have had to take furloughs or unpaid time off. And we're focused on supporting a loan relief fund that can help Colorado small businesses weather the crisis, particularly those that weren't included in the Paycheck Protection Program. Bolstering our unemployment insurance program and adding provisions like work share, which is good for employers and employees. Working towards how we can make some of the temporary measures around the health emergency leave with pay rules at the Department of Labor into a more permanent form of paid sick leave that makes sure that sick workers don't have an artificial incentive to go to work or lose their paycheck. And that's very important. It's one of the ways that we've handled this epidemic from the beginning, and that needs to continue. So employers, if they're feeling ill, are able to stay home and get tested. If it is COVID, they need to remain isolated until several days after the last symptom subsides. If it's not COVID, they can return to work when they feel better. And we do have the testing capacity. It is free. That's another part of the restaurant plan. Employees need to get tested promptly if they're ill to see whether it's COVID or non-COVID. The pandemic really has shown the need for this. We also want to work with the legislature to take some of the regulatory relief, the relaxed regulations like curbside pickup and delivery of alcohol, which has been a lifeline to keeping restaurants in business during this time, and allowing restaurants to do that in a more prolonged fashion. That should not end right away. Our restaurants are in for some difficult times, and we want to waive every rule and regulation we can to help them get through, whether it's utilization of public spaces or whether it's simple things like curbside pickup and delivery of alcohol, which has been done in a very safe way that honors the age of majority in Colorado for drinking. And finally, we need to support people who are leading our response to this pandemic. That's our frontline heroes. We need to make sure that fire and ambulatory and health and hospital districts throughout our state are able to have the resources they need to meet this extraordinary crisis. Now, we were able to do that in part temporarily through the disposition of the CORES Act funding. But this year, I also support the bipartisan efforts to repeal or modify the outdated provisions of the Gallagher Amendment. This year, and in many years, the formula of the Gallagher Amendment simply doesn't work. It applies a statewide formula everywhere, regardless of the ratio of commercial to residential in each area. In many communities, the Gallagher Amendment triggers automatic tax increases on small businesses, making it even harder for Main Street businesses to be able to exist in communities that are primarily residential at the time that they can least afford it. So we need to stop these small business tax hikes. We need to protect our frontline heroes. We're very encouraging a bipartisan group of lawmakers to put the Colorado HEROES Act on the ballot. And I want to specifically thank Senator Jack Tate, a Republican, and Senator Chris Hansen, a Democrat, for their leadership on this important bipartisan proposal. By focusing on these things, on resiliency, on lowering healthcare costs, supporting our Colorado businesses and workers, investing in public health, we can ensure that Coloradans return from this pandemic stronger than ever before, and we can lessen the severity of the economic impact, the duration and the severity in our state. So welcome back to our legislators. I'm looking forward to working with our Republican and Democratic legislators, these dedicated public servants putting themselves at risk by getting together to help tackle this public health and economic emergency and get things done for Colorado. With that, I'm happy to open this to questions. Yes.
Governor, when will restaurants be able to increase their capacity beyond 50%? A survey by the Colorado Restaurant Association says that 9% of them surveyed said they would not be able to survive under a 50% restriction. When can it perhaps be increased to maybe 75%?
They can increase well above 50% tomorrow. They can be at 100, 150%, 200%. The use of the outdoor spaces is absolutely critical. And so there is no limitation on what capacity they can serve. The spacing of the seats, both indoors and outdoors, needs to be at 6 feet. But I fully expect that many Colorado restaurants will be opening at 75, even 100% capacity tomorrow.
Sit outdoors. Maybe they're a small mom and pop restaurant where 12 people depend on an income and they can't do that. What do you tell them? When will they be able to increase?
Yeah, so right now the data and the science indicate that this disease is much more transmissible if you're within 6 feet, and that's been borne out by a number of studies. It's also more transmissible indoor than outdoors. I would encourage the municipalities to work to provide outdoor space for those small businesses, which might mean a sidewalk, which might mean municipal parking. It doesn't even have to be adjacent. It can be, half a block away, right, where the wait staff go back and forth and the tables are set up. So think creatively. If we're going to get our restaurants through this, and we're going to do it in a safe way, I'm calling upon our entrepreneurs in the restaurant industry, and I'm calling upon our municipal leaders to think creatively. And I'm even calling on our private sector landowners. If you own an empty plot near a restaurant, be generous and be creative. You're not doing anything with it. I mean, charge them $100 a month to be able to set up tables there. I mean, make sure that they have the liability, not you. But please, let's be team players here. Let's get folks through this. Your private plot is worth more if there's thriving restaurants on either side of it. So be a team partner. Be a team partner. Private landowners, municipal landowners, and of course, some, as you indicated, some restaurants themselves own space that they can set up additional tables without having to consult with anybody as well. They're fortunate. Telephone, please.
Governor Polis, good afternoon, and thank you again for this opportunity. It's David Clue over at Denver 7. So with so much of the state now headed down...
Please repeat your question.
Yes. With so much of the state now headed down the path of gradual reopening, is there a plan to reopen the state's casinos, and when might we see guidelines for that industry?
So our state has gaming. It's not, we're closely watching areas that have a gaming-based economy like Las Vegas, which just dipped its toe in the water with some casino opening. There's some California Indian casinos that are open. We have in Teller County and Gilpin County. We have some Indian gaming. We're looking forward to working with all counties to figure out that plan. This is not a statewide activity, so I expect the nexus of action to be at the county level. So Teller County has already expressed an interest in reopening their casinos, so they are working with CDPHE on those health guidelines for doing that. We would also welcome, when Gilpin is ready, to have that discussion with CDPHE when the county wants to do it about how it can be done in as safe a manner as possible. So it's unlikely to be an overarching statewide issue. It'll be when counties are ready and have solid plans in place that they are able to show that they're using the best science and learning from other areas that have gaming to reopen gaming in their areas. Yes.
Governor, do you support an effort to mandate that businesses offer 1 hour of paid sick leave for each week that a worker has been on the job, capped at 48 hours a year?
Well, you're being very specific there, Jesse. I talked briefly about the concept of we need to have paid sick leave. You're talking about something very particular. You said 48 hours a year. That's what, little over 5 work days a year? 5 to 6 days a year. Yeah, I mean, that's about what's needed. People need it, and this is for hourly workers. Most salaried workers have sort of the standard is they have at least 2 weeks vacation. There might be some that have 1 week, many have 3 or 4. If there's some salaried positions that have none, they should have some. But this is mostly talking about hourly workers. They generally have none, meaning if you don't go to work, you don't get paid. That's the nature of an hourly position. What's being talked about, and actually what is actually in place now through an emergency order, is we have a paid sick leave. So if you're saying, look, if workers, hourly workers, work full-time at a job, they get 5 paid sick leave days a year. When they're sick, they get paid. That would be very good in responding to this public health crisis, because then if they're a little under the weather, they will not feel the economic pressure to go in. They instead can go and get tested. And if they are positive, they're going to need to take longer than 5 days off. Thankfully, their salaries will be covered by the CARES Act. And so if they're off for 14 days, it moves over to that. It's not on the employer. If they're negative, they can go back sooner than 5 days, right? They can go back the day after they're negative. That could be day 3, but then they have another 2 days in the bank if they get sick again in 3 months. So this is very important to figure out, because particularly in industries where people are around others and interact with others, there should not be an economic incentive to go into work when you are ill. That would be a dangerous way that this virus could further spread and necessitate additional site-based closures if it's not caught early in the process. So I hope that the legislature works thoughtfully with the business community, with restaurants and others on finding out how we can implement a meaningful paid sick leave policy for hourly workers in our state. Telephone.
Hey, Governor, this is Ellis Arnold with Colorado Community Media. Thanks for taking our questions today. Two-part question here. What would you tell restaurant owners who are on the verge of going out of business or may have already gone out of business due to the state's restrictions since mid-March? And secondly, is there any immediate financial assistance, such as loans or grants, that the state can provide to help keep these restaurants survive? You mentioned a loan relief fund. Is that something the state can do right now?
So many restaurants are participating in the Paycheck Protection Program, but as originally constructed, it didn't work perfectly for them because they didn't have a big payroll, or any payroll in some cases, during the time period where they were closed. So we support additional flexibility. Some of that has been granted under guidelines. We hope there's a piece in the next federal legislation that applies specifically to tourism businesses, to restaurants. We recently got some additional guidance around the small ski resorts that are now able to deploy those paycheck protection loans. They would not have been able to as well. So while restaurants are back, and many can be at full capacity or more, it doesn't mean the customers are back. And many folks want to stay safer at home, particularly if they're in an at-risk category. It's a tough time for restaurants. So we want to do everything we can, including working with the legislature around a small business relief fund, including waiving all the regulations around outdoors and using public spaces, including anything else that the restaurants can work on with the legislature or with us to help make sure that we have a thriving, dynamic restaurant industry. Certainly part of that was getting them open, and we're doing that ahead of many states. And, I understand there's some risk in that. And there are those who would urge caution and say don't open restaurants for another month, and there's some states that aren't opening them for many more weeks or months. But I think for our state, it's a matter of survival, and really is a matter of when, not if, we wanted to do it in as safe a way as possible. And so having these thoughtful guidelines in place is a way that while dining in and dining outside at a restaurant is a activity that is reasonably safe. It's not as safe as it was in January, February. It's not as safe as staying at home. But if it's a choice you want to do to break bread with others in a dining establishment, with these rules, we've made it reasonably safe, at least safe enough to prevent another exponential growth curve, is what our data, at least the early data, indicates. Yes?
Dr. Samet's modeling that was unveiled by CDPHE this morning discussed the idea that you have very little wiggle room when it comes to sort of lessening further social distancing requirements. Going from 65 to 55, for example, would lead to a spike in ICU utilization. Do you think it's time for Colorado leadership to be honest with Coloradans about what we can expect, not just next month, but in the months to follow when it comes to crowds? Meaning anything over 50 is not likely, not just in June, but in July, August, September, October, because of that modeling that you are relying on. Is it time to be honest about how long this is going to last, and more specifically, the implications that has for not only Colorado's tourism industry, but for sporting events and concerts and those types of things?
Yeah. Well, we're certainly always honest about what to expect, but the truth is, I don't have a crystal ball. We're not making decisions for August and September based on modeling, period, because the modeling, as well as and instructive as it is for our immediate needs, is not determinative. We're going to know a lot more where we are. So we've really tried, I think better than many other states, to at least show people what the next month looks like, subject to tweaks along the way. We did that for April, we did that for May, we're going to do it for June. It doesn't mean there couldn't be mild course corrections. If things are going well, late June, we might be able to move a little bit further. But we're doing that each month. If you're saying, what does July and what do August look like? I can, of course, tell you they're not going to look like normal. But we're going to do as much as we can in our state without allowing for another resurgence that overwhelms our hospital capacity. And that won't be based on the current modeling. It'll be based on the actuals for what we have. We value, Dr. Samet's model has been incredibly valuable. I also indicate it's not the only model we look at. We look at other international and national models to help inform our decision making. Two main takeaways from Dr. Samet's model. You mentioned one. Another one is we have to, for any of this to work, sustain greater social distancing for older Coloradans. So in any of these incarnations, younger Coloradans, 55, 65%, but we have to maintain 80, 85, 75% for those who are at higher risk. not just for their own sake, which we deeply care about. My parents are staying at home because I love them and I don't want to put them at risk, but also because far more need hospitalization. So for every infection of a 75-year-old, it's about 5 times more likely they're headed to the hospital than a 40-year-old. That's just an approximation. We can, I don't know if it's 5 or 6 or 4, but it's a multiple of times more likely. And so we need that additional social distancing for those who are older, and that includes people of all ages who have respiratory conditions or are at greater risk. And we also need to continue to enforce the social distancing and meet those guidelines. So I feel that for as much visibility as we have, we're completely honest about where things are. And I can honestly tell you, and I'm sure even Dr. Samet would confirm, that we don't know what August and September look like. And we're not going to lock ourselves into something based on predictions. We're going to use the predictions to guide our current actions, and then we're going to base future actions based on data we have then, and also better informed projections that we have then. This modeling has gotten better every time, right? It was very coarse early. It's gotten more and more refined. There'll be better modeling in July for what August and September look like. There'll be better modeling in August for what September and October look like. The more information we have, the better Dr. Samet's model is, the better all of the national and international models are. Telephone, please.
Yeah, this is Grant Stringer from the Aurora Sentinel, and I had a two-part question as well. The first part, how many new contact tracers has CDPHE hired since mid-March? And the second part, short of more federal dollars coming down into state government and to local public health authorities from there, can the state pay for this capacity expansion that you've said will be critical?
So with specific numbers, I'll have our team, Connors here, get back to you with that. I know we've doubled the number of epidemiologists at the state. A lot of the tracking and tracing activity and hiring is formally at the county level, county health departments. There is some at the state level, and we'll be happy to give you the information we have. We also talked about our partnership with AmeriCorps, 500, the very first cohort of AmeriCorps folks that are working on tracking and tracing will be arriving soon. I think we have a date. Connor will get you that date as well. It's about 2 weeks from now or so that we will be having those 500 that join us. Yes.
En español, Jesús Sánchez del Comercio de Colorado. ¿Pueden los restaurantes en Colorado negar servicio a clientes que no lleven máscaras?
Otra vez, por favor.
¿Pueden los restaurantes negar atender clientes que no lleven puestas las máscaras?
Sí. Es una necesidad que todos los empleados de restaurantes lleven tapabocas durante su día de trabajar. Para clientes, para gente quien ir a restaurantes, no es necesario, pero es una buena cosa para hacer porque es más seguro para usted y también para los trabajadores. Es importante llevar tapabocas cuando estás entrar al restaurante, cuando sentarse en la silla, puede no más tapabocas y comer y hablar con su gente, y cuando ir del restaurante también lleve su tapaboca. Yes.
Rent is almost due. Are you planning to extend your order on evictions and court filings?
Well, the courts were unable to process eviction notices this month of June. They were also unable to do so in May. I'm sorry, this month of May. They were also unable to do so in April. I believe that courts will have some increased capacity in June. They certainly have other priorities, but there are probably some folks that have been delinquent for some time that could be evicted. I would envision a slow return to normalcy is I think the approach the courts will take. And I think there's also some discussion with the legislature about right to cure and other things that we can do to try to make sure that folks, if they had a one-time event in their lives, are back on track for their housing. Telephone?
Hi, this is Ann Shimke from Chalkbeat, Colorado. I'm wondering how you reconcile the goal of opening schools in the fall with the modeling data that shows cases increasing in August.
Well, obviously, we all want to open schools in the fall, but that'll be based on actual data. All models are very helpful. National models, international models, Dr. Samet's model in particular, because it informs our decisions here. But decisions will be made about return to school based on where we're actually at, not based on foggy depictions of what our future might be. My expectation is that in most areas of the state, kids will be able to return to school in a reasonably safe way. The flip side of that expectation is there could very well be areas of the state, communities or districts that have a high viral rate at that point and might have to begin online for a few weeks. I hope that there's none of those, but there absolutely could be some. Colorado Department of Education worked with us in releasing the first draft of some of the working document with ideas about how schools can be safer. That will improve its iterations over the summer. And I remain hopeful that the vast majority of kids will be able to return to physical school in the fall, but those decisions will be based on actual data in August.
Over the weekend, the Capitol was broken into, and I'm trying to find out, was your office impacted by that, and do you feel like there was any specific motivation behind that? And also, if you could please talk to the bar owners in the state, what are you telling them now? What's the outlook for them?
So I know that it occurred. I was briefed that it occurred, but I don't have the details, so you'd have to get those from the state troopers or the police. But I know that there was some sort of break-in. So the only information I know is that there was a break-in. So I've been very busy with other things. I haven't been told that there was any damage or anything. So I'm sure the state troopers can give you a readout or what happened. But there was some sort of break-in over the Capitol, and I was informed of that. There are many breweries, perhaps even some bars that can operate under these restaurant guidelines. They do not distinguish based on license, and that's very important. They certainly don't say no distilleries, no breweries, no bars. It's a question of business model. Essentially, what we're talking about is the social environment of these businesses. If it's a social environment where a group of 4 or 6 people come in, sit together, and enjoy whatever they're enjoying, whether it's a drink or dinner or whatever it is, it falls under the restaurant guidance. If it's the kind of social free-for-all where groups associate with one another, hundreds of people, that even in areas with significantly lower cases of the virus than Colorado, than of America, including areas like South Korea, single incidences of nightclub and bar-like environments have led to dozens of cases. And so the activity is not by license type. Bars can be creative and distilleries can be creative, and they can open if they choose. But it's not the social environment that they had before. It's not 100 people mixing together. It's a group of 4 being seated, a group of 6 being seated, a group of 2 being seated at 6 feet apart, and you're there with the group you came with. You're not in a social free-for-all. So many of them, that's not consistent with their business model. They're likely to remain closed through June and maybe even July. Others are trying to adapt their business model to see if they can have an environment that fosters those intimate social exchanges between preformed parties rather than a free fall of interactions between hundreds of people. Last one from the telephone, please.
Steve Steger from 9 News. Following up on that a little bit, one of the requirements in the release is a requirement for breweries to serve food as well. Can you explain the reasoning behind that requirement? Why does food have to be part of the business model?
So I've been to breweries, and the normal environment in a brewery is a lot more like a social free-for-all. They're fun, they're social. You hang out with your friends, you see other friends across the room, you talk to them. It's not normally the kind of environment where you go with 4 people, you sit down, and you don't interact with others. To the extent that they adapt to become like that model, like that restaurant model, they are absolutely able to open during the month of June. What that means is it means that groups sit down with who they came with, and there's not that social mixing. We're happy to explore additional ways that they can do it, but it was many of the breweries that had the idea that I think during the public comment period they put in that expanded this to include them, and some of them might have food trucks, some of them might have kitchens that are preparing it, but the key concept is not the food. It's not about food. Food doesn't make it any safer. What makes it safer is the expectation socially that you're with your party. It's 2, if it's 4, it's 6 people, 8 people max, and it's not an environment to mix with other parties. It's one to break bread or beer with those who you came with, facing each other, talking to each other. The only people at risk, presumably, are the people in that party. It's not talking to hundreds of friends and freely moving between parties. So that was the goal. It can certainly be refined in the days ahead to meet that, but a lot of the changes that were made to include breweries and distilleries were based on public input, and many of them were interested in altering their business model to a non-social environment with fixed parties to help make sure that they can thrive in a way that doesn't set us all back. So thank you all again, and for everybody out there, we are going to stay as safe as we can. For many folks, that means staying at home. If you can stay at home, it's the safest thing to do. In the outdoors, away from others, very safe. For those who are beginning to interact and go about your business, these guidelines don't make it safe, but they make it as safe as reasonably possible, consistent with the needs of the private sector to operate and thrive, and consistent with the needs not to prevent an outbreak that overwhelms our hospital capacity. Thank you.
And that wraps up a 1-hour update from Governor Jared Polis on the state of the state when it comes to COVID-19 and the pandemic. He started with the very sad news that a 15th resident at the Veterans Home, Colorado Veterans Home at Fitzsimmons, has passed away. But also some good news. The hospitalizations are now under 400 in Colorado, continuing a 12-day downward trend. The state is also meeting its capacity, can meet its capacity of 8,500 COVID-19 tests a day. And the governor, of course, spoke at length about tomorrow, the reopening of dining rooms across the state, restaurateurs who have to limit their capacity to 50%. And he spoke about how they can make the most of that. We'll, of course, have many of these details on 9news.com and more on our shows this evening starting at 4 p.m. We will see you then.